Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Choice of anticoagulants to prevent abnormal uterine bleeding. Women of childbearing potential have a very high prevalence of venous thromboembolism due to high estrogen states such as pregnancy and the use of estrogen-containing contraceptives. Abnormal uterine bleeding affects up to 2/3 of these women on anticoagulation and can severely impair a woman's quality of life, according to a study in the Thrombosis Update journal. Low dose aspirin in pregnancy, a high risk for preeclampsia. A recent study in the Pregnancy Hypertension Journal says that low dose of aspirin triggers the biosynthesis of endogenous anti-inflammatory molecules, which may counteract the inflammatory process of preeclampsia and play a role in low dose aspirin's mechanism of action in preeclampsia prevention in high-risk patients. Colchicine, cheap and low-risk medication to reduce major adverse cardiovascular events in patients undergoing PCI. Percutaneous Coronary Intervention, that is PCI, is the preferred coronary reperfusion strategy that induces the endothelial trauma, which may scale as an inflammatory response. This may increase the likelihood of various further cardiovascular events, and the study appearing in the BMJ journal Open Heart says that colchicine is a cheap and widely used anti-inflammatory drug shown to have promising effects in cardiovascular outcomes. The study showed that colchicine did reduce the major adverse cardiovascular event risks in coronary artery disease patients who underwent percutaneous coronary intervention procedures. Eating prunes may help protect against bone loss in postmenopausal women. Prunes are popularly consumed fruits, and the sorbitol content of dietary fiber likely provides the laxative effect associated with eating prunes and many other beneficial effects. In a recent research review, the researchers found that prunes can help prevent or even delay bone loss in postmenopausal women, and possibly due to their ability to reduce inflammation and oxidative stress, both of which contribute equally to bone loss. Now published in the journal Advances in Nutrition, the study says that potential mechanism for the effects of prunes triggering a change in the gut microbiome can lower inflammation in the colon, as it's a very good practice helping bone health on consumption. Depression strongly linked to lower urinary tract symptoms in men. Depression has been a potential health concern, and lower urinary tract symptoms including voiding or obstructive symptoms such as hesitancy, etc. are affected as well. Men's lower urinary tract symptoms and depression have a bidirectional relationship, according to a new data from observational studies published in the journal Neurology and Urodynamics, and this suggests that there are common risk factors that cannot be assigned entirely to the prostrate. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.